The Health and Wellness Fair was held Wednesday, April 18th in the gym at Our Lady of the Lake University. Several vendors and medical providers volunteered their time to inform and provide free services to students, faculty, and staff.
Well, blood pressure is called the silent killer because you can't really tell when you have high blood pressure, so it's important to screen for it early on just to make sure that if it starts to get high, you can follow up with your doctor and either go on medication or have lifestyle changes.
Other services provided included mammograms, hearing tests, immunizations, and men's health screenings.
What I'm doing here is I'm promoting our men's health program on the University Health System. Open up several clinics for guys to get healthcare services. And if they're uninsured and unemployed, they qualify for free services with our program. Our main goal is to get guys to start thinking about their healthcare a little bit more. Women are more likely to go to a doctor. On a national average, 60% of women reported going to the doctor. For men, it was only 2%. So here in Texas, we're trying to increase that number by at least 11 to 15, and it's all preventative health care. So they come in for family planning, physicals, diabetes, blood pressure checks, STD testing, STD treatment, HIV testing, and other health assessments. And so that's why I'm here, and trying to get guys to start thinking about their health care.
Faculty and staff populated the fair, however, students were absent from the event, leaving one to wonder how students lead healthy lifestyles in a city stated as the 25th fittest by Men's Fitness magazine.
Yes, my fish is the protein, those are the vegetables, and these have carbs, and then the bread is green. And I don't really see a lot of people working here. I work out every day. Oh, I run, and I lift weights, and I go swimming, and I go bike riding, and I do cardio.
After interviewing students in the cafeteria on their food choices and knowledge of food groups as indicated by the United States Department of Agriculture, it was appalling how many students weren't aware of the National Consumer Nutrition Outlines. Even more daunting was the common inability to take accountability for their food choices. All continued to blame the selection of portions of food provided by the cafeteria.
It's because the pasta is really soaked in the sauce and salads don't really have much on them. Like, I think there could be more healthier choices. I think I try to eat a little bit of everything. We eat a lot of junk food.
So we're going to have proper portions, and we didn't have to do a lot of math to make that happen.
Like what to eat and how much to eat them.
There's obviously a gap in educating youth on proper nutrition. Many organizations that recognize this, like School Food Campaign and Ministry of Food, focus in on grade school children when there is a need for education amongst collegiate audiences. The San Antonio Food Bank was one of the many informative vendors on campus which provided information on plaque buildup in the arteries, the risks of high sugar intake, and the myplate.gov, which replaces the formerly outdated food pyramid.
First of all, if it's a large portion, you want to pack half to go and eat half now, but you want to be sensible about your choices as well. For example, on salads, you want to pay attention to what all is in your salad. If it's a lot of dressing and bacon and croutons and not enough vegetables, then you're not going to get as much nutrition from vegetables. If you're getting something like a bread, maybe choose a whole grain and get a proper portion of it. If somebody serves your plate for you, then you can just kind of keep this pattern in your mind and eat according to this and leave the rest.
The void of nutritional education held by college students on OLLU campus is a scary realization that free health events will not suffice in helping a collegiate audience make healthy choices. This is Catherine Espinosa reporting with Our Lady of the Lake University.